So one of the things that we teach, I think, very well in nursing school is how to complete an assessment. Head to toe, system by system, gather all your information. But there's something that's equally as important that we don't often talk about, and that's how to know when you should not finish the assessment. So sometimes you've already found enough information that you know that your patient needs something right now, and recognizing that moment is part of nursing judgment. So for instance, you walk into your patient room, you start your assessment, and you get to their lungs and you start listening, and you notice that they have a significantly increased work of breathing. So you're watching and you can see that they're using accessory muscles. When you're talking to them, they're struggling to speak, and their color just doesn't seem right to you. You don't need to finish the entire head to toe to know that your priority has changed and that your assessment has given you all the information that you need to know that you require action. And so this is sometimes where new nurses can get stuck. In nursing school, you get trained to collect the data, and you want to make sure you have all of the information before you call somebody. So you go, okay, let me just finish this assessment, or let me just get a set of vital signs, or let me just check one more thing. But what if there's situations where gathering more information can actually wait? So your first responsibility is recognizing that the patient is deteriorating and respond appropriately. So how do you know when to stop? So a couple things to think about. First, is there immediate threat, right? Airway, breathing, circulation, neurological status, disability, right? If your patient's struggling to breathe, becoming less responsive, showing poor perfusion, any acute change, that's your priority. So regardless of why you entered the room, you can continue gathering data when it's safe to do so, but make sure that help is coming, right? So you're gonna call for help. Don't delay calling for help just to get your assessment. The next thing is, has something changed significantly from the baseline? So this is why knowing your patient matters, right? Getting a good report matters, because the numbers themselves aren't just going to tell a story. So if the patient was alert and interactive an hour ago and is now difficult to wake, I'm probably a little bit concerned. What if you're just uncomfortable with what you're seeing, even if you can't explain it yet? So this one can be important, because as you build clinical judgment and as you build experience, sometimes you don't know why, but you know something is not right. So you don't need to determine what's causing it to escalate, right? Our job is not to diagnose. Our job is to assess and provide information and support our patient. And so you're looking for concerning findings and then communicating those and advocating for reassessment or further assessment or interventions. And so even just something as simple as saying, my patient's had a significant change from baseline, or I'm just concerned something seems off, that's completely fine. We've talked about this before. Get a second set of eyes if you need them, but don't delay just to get more information. And just because you've paused your assessment to go and get help doesn't mean that you stop nursing. You still come back, you obtain vital signs, you complete the assessment, you position the patient, you apply any interventions that are within your roller scope and your protocols to apply. You communicate clearly. You use SBAR to make sure that all of the information that you've seen and assessed gets to the other clinicians that require it. You reassess. Has anything changed since I stopped the assessment? And then, of course, you document what you observed, what you did, who you notified, what happened next. But you're doing all of those things while getting a response to your concern. You're not delaying the response just so you can complete your assessment checklist. A really big shift from nursing school to graduate nurse is that assessments are not linear. So you can start an assessment, find something very significant, respond, reassess, and finish the rest of the assessment later. It's not an incomplete assessment, it's clinical judgment. So the next time you're assessing a patient and something says to you, I don't like this, don't just say, hey, I just need to finish my assessment. Say, do I need more information, or do I have enough information to act? Because sometimes the most important thing that you can actually do during an assessment is know when to stop and get help.